Hello, friends. Today we are going to start a new topic. What do you know all about cancer? I think you will know new things from this and gain quite a bit of knowledge about that. Cancer is only going to be a chapter in your life, not the whole story. Joe Wasser. I am Dr. Jagatjit Singh Virk, presenting to you this topic. Let's see what is the normal cell. Normal cells have normal DNA and a normal number of chromosomes. Cancer cells often have an abnormal number of chromosomes, and the DNA becomes increasingly abnormal as it develops a multitude of mutations. Some of these are driver mutations, meaning they drive the transformation of the cell to be cancerous. This is a diagram of normal cell versus cancerous cells. Normal cells are many cells that continue to grow and divide, and variations in size and shape of cells between the two. Then nucleus that is larger and darker than the normal here and here. Abnormal number of chromosomes in the cells arranged in a unorganized fashion. Cluster of cells without a boundary here, and all this is. What is cancer? Cancer is a disease in which some of the body's cells grow uncontrollably and spread to other parts of the body. Cancer can start almost anywhere in the human body, which is made up of trillions of cells. Normally, human cells grow and multiply through a process called cell division to form new cells as the body needs them. When cells grow old or become damaged, they die and new cells take their place. Sometimes this orderly process breaks down and abnormal or damaged cells grow and multiply when they shouldn't. These cells may form tumor, which are lumps of tissue. Tumors can be cancerous or not cancerous, that is benign in nature. Spread of cancer. Cancerous tumors spread into or invade nearby tissues and can travel to distant places in the body to form new tumors, a process called metastasis. Cancerous tumors may also be called malignant tumors. Many cancers form solid tumors, but cancers of the blood, such as leukemia, generally do not. Benign tumors do not spread into or invade nearby tissues. When removed, benign tumors usually don't grow back, whereas cancerous tumors sometimes do. Benign tumors can sometimes be quite large. However, some can cause serious symptoms or be life-threatening, such as benign tumors in the brain. Normal versus cancer cells. Cancer cells differ from normal cells in many ways. For instance, cancer cells grow in the absence of signals telling them to grow. Normal cells only grow when they receive such signals. Ignore signals that normally tell cells to stop dividing or to die, a process known as programmed cell death or apoptosis. Invade into nearby areas and spread to other areas of the body. Normal cells stop growing when they encounter other cells, and most normal cells do not move around the body. Cancerous cells tell blood vessels to grow towards no tumors. These blood vessels supply tumors with oxygen and nutrients and remove waste products from tumors. Cancerous cells hide from the immune system. The immune system normally eliminates damaged or abnormal cells. Cancerous cells trick the immune system into helping cancer cells stay alive and grow. For instance, some cancer cells convince immune cells to protect the tumor instead of attacking it. Cancer cells accumulate multiple changes in their chromosomes, such as duplications and deletions of chromosomes parts. Some cancer cells have double the normal number of chromosomes. Cancer cells rely on different kinds of nutrients than normal cells. In addition, some cancer cells make energy from nutrients in a different way than most normal cells. This lets cancer cells grow more quickly. How long a cancer cell can divide? Another hallmark of cancer cell is their replicative immortality, a fancy term for the fact that they can divide many more times than a normal cell of the body. In general, human cells can go through only about 40 to 60 rounds of division before they lose the capacity to divide, grow old, and eventually die. Do cancer cells divide fast? This process of maturing is called differentiation. In cancer, the cells often reproduce very quickly and don't have a chance to mature. Because the cells aren't mature, they don't work properly. And because they divide quicker than usual, there is a higher chance that they will pick up more mistakes in their genes. Do cancer cells divide continuously? While normal cells will stop division in the presence of genetic DNA damage, cancer cells will continue to divide. Do cancer cells multiply or divide? Even if one cancer cell is left behind, it can grow and divide to become a new tumor. A new tumor can start to grow in the same area of the body where the cancer first started, or the cancer may have spread through the blood or lymphatic system to another part of the body where it grows into a new tumor. What happens if your cells stop dividing? The process then repeats in what is called the cell cycle. If a cell cannot stop dividing when it is supposed to stop, this can lead to a disease called cancer. Some cells, like skin cells, are constantly dividing. We need to continuously make new skin cells to replace the skin cells we lose. How long do cancer cells live? Cancer cells do not have a regular lifespan like normal cells. They can grow uncontrollably, often spreading to other areas of the body. This spreading is known as metastasis. Although cancer may spread to other organs, it is always named for the organ where it started. How fast do cancer cells grow? Scientists have found that for most breast and bowel cancers, the tumor begin to grow around 10 years before they are detected. And for prostate cancer, tumors can be many decades old. They estimated that one tumor was 40 years old. Sometimes the growth can be really slow, says Graham. How do cancer cells divide? Cancer is unchecked cell growth. Mutations in genes can cause cancer by accelerating cell division rates or inhibiting normal controls on the system, such as cell cycle arrest or programmed cell death. As a mass of cancerous cells grows, it can develop into a tumor. Why do cancer cells divide uncontrollably? Most cancer-causing DNA changes occur in sections of DNA called genes. These changes are also called genetic changes. A DNA change can cause genes involved in normal cell growth to become oncogenes. Unlike normal genes, oncogenes cannot be turned off, so they cause uncontrolled cell growth. Can a tumor cell grow overnight? They emerge at night while we sleep, unaware, growing and spreading out as quickly as they can. And they are deadly. In a surprise finding that was recently published in Nature Communications, Weizmann Institute of Science researchers showed that night time is the right time for cancer to grow and spread in the body. What stops tumor growing? A new study has found that resolvins, compounds naturally secreted by our body in order to stop the inflammatory response, can stop tumors from growing when such growth is induced by cellular waste. Do tumors grow quickly? Malignant tumors can grow quickly and spread to other parts of the body in a process called metastasis. The cancer cells that move to other parts of the body are the same as the original ones, but they have the ability to invade other organs. How does cancer cells spread? When cancer spreads, it's called metastasis. In metastasis, cancer cells break away from where they first formed, travel through the blood or lymph system, and form new tumors in other parts of the body. Cancer can spread to almost anywhere in the body, but it commonly moves into your bones, liver, or lungs. How many cancer cells are in a tumor? The number of cancer cells is a function of tumor volume in cubic centimeters. Each cell is about 20 nanometer in diameter. A 1 centimeter cancer has about 100 million cells. A 0.5 centimeter cancer has about 10 million cells. And a 1 millimeter cancer has about 100,000 cells. Do tumors always mean cancer? A tumor is not necessarily cancer. However, a tumor is defined as the swelling of a part of the body, generally without inflammation, caused by an abnormal growth of tissue, whether benign or malignant. It is also defined as a swelling of any kind or a mass. So, by definition, a collection of pus can be tumor. Can exercise shrink tumor? We all know exercise is good for us, but moving your body can also help fight some deadly ailments. Two recent studies show that exercise not only slows solid tumor growth, but it can even spread up recovery in patients with critical illnesses. Can a tumor stop growing? When a malignant tumor is contained within one area and hasn't spread to the surrounding tissue, the medical term is carcinoma in situ. If the tumor stops growing, doctors say it is dormant cancer cells. The way a tumor feels depends on its size, location, type, stage, and other factors. A cancerous lump in the breast, for example, tends to feel firm or solid and might be fixed to underlying tissues. Such lumps are often painless but do produce pain in a small percentage of patients. Are tumors curable? Some brain tumors grow very slowly, low grade, and cannot be cured. Depending on your age and diagnosis, the tumor may eventually cause your death, or you may live a full life and die from something else. It will depend on your tumor type, where it is in the brain, and how it responds to treatment. Can cancer develop in 6 months? If you are wondering how long you can have cancer without knowing it, there is no straight answer. Some cancers may be present for months or years before they are detected. Some commonly undetected cancers are slow growing conditions, which gives doctors a better chance at successful treatment. Do cancer symptoms come? If some health condition tends to come and go every now and then, it is unlikely to be a cancer. Cancer tends to show a constant set of symptoms that worsen over time, with a couple of new symptoms added over time. Are we born with cancer cells? No, we don't all have cancer cells in our bodies. Our bodies are constantly producing new cells, some of which have the potential to become cancerous. At any given moment, we may be producing cells that have damaged DNA, but that doesn't mean they are destined to become cancer. How normal cells become cancer cells? Cells become cancerous after mutations accumulate in the various genes that control cell proliferation. According to research finding from the Cancer Genome Project, most cancer cells possess 60 or more mutations. What are the 7 signs of cancer? Caution: 7 cancer warning signs you shouldn't ignore. C for change in bowel or bladder habits. A for sore that does not heal. U for unusual bleeding or discharge. T for thickening or lump in the breast or elsewhere. I for indigestion or difficulty in swallowing. O for obvious changes in warts or moles. N for nagging cough or hoarseness. How can you test for cancer at home? There is no specific test that diagnoses cancer at home with complete certainty. However, people can use self checks to help spot any changes or abnormalities as early as possible. Anyone who notices anything unusual during a self check should speak with a doctor as soon as possible. Are cancer cells alive? Cancer cells have unique features that make them immortal, according to some researchers. The enzyme telomerase is used to extend the lifespan of cancer cells. While the telomeres of most cells shorten after each division, eventually causing the cell to die, telomerase extends the cell's telomeres. What are the warning or danger signs of cancer? Warning signs of possible cancer include the following: unexplained weight loss, fatigue, night sweats, loss of appetite, new persistent pain, recurrent nausea or vomiting, blood in urine, blood in stool, either visible or detectable by special tests. Which test is for cancer? Imaging tests used in diagnosing cancer may include a computerized tomography CT scan, bone scan, magnetic resonance imaging MRI, positron emission tomography PET scan, ultrasound and X-ray, among others. Biopsy. During a biopsy, your doctor collects a sample of cells for testing in the laboratory. What are the 4 stages of the cell cycle? In eukaryote, the cell cycle consists of 4 discrete phases: G1, S, G2, and M. The S or synthesis phase is when DNA replication occurs, and the M or mitosis phase is when the cell actually divides. The other 2 phases, G1 and G2, the so-called gap of phases, are less dramatic but equally important. This is a diagram of cell division. First phase is prophase. Chromosomes condense and become visible. Spindle fibers emerge from the centrosomes. Nuclear envelope breaks down. Centrosomes move toward opposite poles. In the pro-metaphase, chromosomes continue to condense. Kinetochores appear at the centromeres. Mitotic spindle microtubules attached to kinetochores. Metaphase, chromosomes are lined up at the metaphase plate. Each sister chromatid is attached to a spindle fiber originating from opposite poles. Anaphase, centromeres split in two sister chromatids, now called chromosomes, are pulled toward opposite poles. Certain spindle fibers begin to elongate the coil. Telophase, chromosomes arrive at opposite poles and begin to decondense. Nuclear envelope material surround each set of chromosomes. the mitotic spindle breaks down. Spindle fibers continue to push poles apart. Cytokinesis. Animal cells, a cleavage furrow separates the daughter cells. Plant cells, a cell plate, the precursor to a new cell wall, separates the daughter cells. Why do cells divide? Cells divide for many reasons. For example, when your skin, your knee cell divide to replace old, dead, or damaged cells. Cells also divide so living things can grow. Organisms grow because cells are dividing to produce more and more cells. Can cancer be prevented? Cancer prevention is action taken to lower the risk of getting cancer. This can include maintaining a healthy lifestyle, avoiding exposure to known cancer causing substances, and taking medicines or vaccines that can prevent cancer from developing. How can we prevent forum cancer cells? Consider these cancer prevention tips. Don't use tobacco. Using any type of tobacco puts you on a collision course with cancer. Eat a healthy diet, balanced diet, plant-based diet, natural diet, and local diet. Maintain a healthy weight and be physical active. Protect yourself from the sun. Longer stay can affect your skin and give a burning effect, but for 20 to 25 minutes of sun bath is good and protective from cancer, as you will manufacture vitamin D in your skin. Get vaccinated, avoid risky behaviors, get regular medical care. Lifestyle medicine. Lifestyle medicine is a therapeutic use of evidence based lifestyle interventions to treat and prevent lifestyle related diseases in a clinical setting. Lifestyle medicine empowers individuals with the knowledge and life skills to make effective behavior changes that address the underlying causes of the disease. Lifestyle interventions to heal cancer. Healthful eating of whole plant based food, increased physical activity, develop strategies to manage stress, form and maintain relationships, improve your sleep, avoid toxic and risky substances. If we adhere to all these interventions, we can avoid and heal cancer. Otherwise, it is very difficult to heal cancer with the normal routine medical treatment. Thank you very much.